I saw that happening, but I also saw how the things that they do to maximize their profit, which really boils down to dumping the sick.
What do you mean dumping the sick?
Two different ways that they do this. In the individual insurance market, we've seen quite a bit of news coverage, especially in California, when insurance companies who are active in the individual market, and this means when you don't get your insurance coverage through your workplace, about the only option you have is to buy it directly from an insurance company, and usually it's much more costly than it is if you buy it or get it through your employer. Once you file a claim, if you are unfortunate enough to get very sick or have an accident and file a claim, you very often will find that your insurance company will go back and look at your application to see if there might be a chance that you either didn't disclose something that you knew about in the past, or inadvertently didn't disclose something, or might not have known about a pre-existing condition. They'll use that as evidence that you were committing fraud, and they'll revoke your policy, or they call it rescinding your policy, leaving you holding the bag, making you completely responsible for all the medical bills. That's one way that they dump people who need insurance the most. Another is if you are employed, particularly with a small business, and your employer gets his or her insurance through one of the large insurers, and if just one person in your company files a claim that the underwriters think is too high, if it skews what they think is the appropriate medical experience or claim experience, when that business comes up for renewal, they very likely will jack up the rates so much that your employer has no alternative but to leave and leave you and all of your co-workers without insurance. Either that, or they may cut benefits or try to shop for coverage somewhere else, but the end result is you may find yourself dumped into the rolls and the ranks of the uninsured.
And this is a man who knows, right? Wendell Potter is a whistleblower. He was the corporate spokesperson for CIGNA, actually all through the time, Stacie Ritter, that you were applying and being denied by CIGNA. But he wouldn't have dealt with this case unless you had gone public, and you've only chose to go public now. Why now?
Well, when you're going through this and you're in the day-to-day, you do everything you can to get through the day. It took me 6 years after the girls' treatment to actually be able to go out and help work towards securing funding and stuff for research for childhood cancer. It takes a while for a family who is being affected by medical problems to have the opportunity to leave their family for a little while to go try to help fix the situation. And that's another thing that makes this so sad, is that they have people at such a huge disadvantage, because when you're going through this and you've got cancer, or your child has cancer, and you just want to make sure that your family is still here tomorrow. So you let these people walk on you for the time being because they're not your priority. It's not till the aftermath of everything. It was a year after the girls were out of transplant that we filed for bankruptcy. And then nobody has time to deal with that when they're sick.
You filed for bankruptcy when actually you were getting Aetna insurance, right? And they were approving the coverage.
Correct. Yep. We actually started out with pretty decent coverage from Aetna initially, when Aetna used to be Aetna U.S. Healthcare. And then Aetna and U.S. Healthcare somehow split and became just Aetna Corporation, and it all went downhill from there as far as Aetna is concerned. But when you're talking premiums, things that aren't covered, caps on your coverage, deductibles, you've got co-pays, you've got different prices that you pay for different medicines and the different formularies, and they nickel and dime you to death, and it all adds up. And when your husband, my husband had to stop working because I was pregnant at the time, and we had a 1-year-old, and between going back and forth from the hospital and somebody watching our son, we really didn't have another, option than for him to stop working. So we had no real income coming in, and we were paying COBRA payments in order to maintain our insurance for my husband, myself, and my son, which was, you know, $715 a month for 7 months on top of it, all the other bills on top of, you know, a lack of income, you go bankrupt.
In fact, you're not alone. The studies show, I think in 2007, the majority of people who went bankrupt because of medical expenses, and the vast majority of them, like 80%, had insurance.
Yes.
Juan?
Well, I just want to ask you, as you hear all this debate in Congress about health insurance reform and providing better health insurance for Americans, you've decided actually to put your body on the line and protest outside of CIGNA. Your concerns as you hear the people in Congress debate this issue?
Well, my concerns is they're going to go ahead and be bought out by the big drug companies. You know, the Democrats now are selling out. They are choosing their own greed and self-need over the needs of the American people. One of the reasons why this is so important to me is my children, who are cancer survivors now, are going to be deemed, you know, they're marked with a pre-existing condition. And if things continue the way that they are, God forbid my husband would lose his job. I mean, they've already taken pay cuts and stuff in order to not have to let people go. But what would happen? Nobody would want to pick me and my children up on an insurance plan. And as soon as my kids grow up and they graduate college, they're going to have to go out and try to get insurance that way, and nobody's going to cover them. Not as things are right now. And I know how slow things work, so we've got to change this, and we've got to change this now in order for children who are 11 years old to be able to access the health care and the need, you know, to take care of their health needs as adults.
Stacie Ritter, I want to thank you very much for being with us, and best to Madeline and Hannah, your identical twin daughters.